Introduction of adrenal lesions through clinically based approach. In this video, I'd like to discuss my approach for adrenal lesion assessment and characterization. Additionally, I will give you a simple, concise concept about normal adrenal physiology and adrenal hormonal dysfunction. If we would like to discuss the adrenal pathology and how can we characterize these lesions, and if we review the literature, either review articles or textbooks, we'll find that those articles mostly demonstrate these lesions and describe them based on the anatomical or radiological findings, either benign lesions versus malignant lesions, or lipid containing lesions versus non-lipid containing lesions, and so on. However, here I'd like to present a more clinical approach. This approach based mainly on a daily practice workup, what you are facing actually in your daily practice. So in the next slide, I will present you a small video animation with funny characters trying to describe this approach. And after the end of this video, we will go through this approach in depth. So from the previous video, we have three common scenarios. The first scenario when you have an active adrenal lesions and the patients have suspicions of abnormal adrenal function and proved by abnormal lab results or by a clinical suspicion from the physician. And you rule as a radiologist to prove or disprove if there is active adrenal lesions or not. The second scenario when you have an extra adrenal malignancy and during the investigation of this patient you find an adrenal lesion, and your rule is to characterize this adrenal lesion. Is it metastatic from the primary tumor or just benign finding? While the last scenario, the third one, when you have a patient came for investigation from other causes other than adrenal causes. Like in the video, the patient came for detection of a stone and there is incidentally discovered adrenal lesion. So how can you deal with those scenarios? So in the next videos, I will produce a separate video discussing each scenario separately. And from those videos, we know how can we deal with each approach and the details of the imaging findings in each situation. Now let us discuss a simple basic of adrenal physiology. As we have already know from the first video, adrenal gland has two main components, cortex and medulla. The cortex represent 90% of the adrenal gland and mainly secretes steroid hormones. These hormones are mainly three groups of hormones: glucocorticoids, mineralocorticoids, and androgens hormones. While the medulla, which represent about 10% of the gland, secretes mainly catecholamines, which are formed in two main categories, epinephrine and norepinephrine. Now let us discuss and demonstrate the hierarchy of pathophysiology of adrenocortical hormones. Adrenocortical hormonal dysfunction either due to hypersecretion or hyposecretion. In case of hypersecretion, and there is hypersecretion of aldosterone from a lesion originating from the adrenal gland, that is what we call primary hyperaldosteronism or what we call Cons syndrome. In contrast, when there is secondary hyperaldosteronism, there is a problem elsewhere in the body causes the adrenal gland to release too much aldosterone. In case of hypersecretion of cortisol that produce a Cushing syndrome, while in the case of hypersecretion of androgens hormone, this is produce androgenetal syndrome. While in the case of hyposecretion of adrenal gland hormones that produce Addison disease, this is a generalized hyposecretion of adrenal gland. In this course, especially the first scenario, will discuss the two main cases regarding hypersecretion of aldosterone that produce Cons syndrome and the hypersecretion of cortisol that produce Cushing syndrome. Thus, through this course, we'll discuss the three main disorders of active adrenal lesions, as we can see here: Cushing syndrome due to hypersecretion of glucocorticoids, Cons syndrome due to hypersecretion of aldosterone hormone, and pheochromocytomas due to hypersecretion of catecholamine. And in the next video, we'll discuss the detailed imaging findings and how can we differentiate between these disorders and what we can do for the next step of investigation and characterization. See you in the next video. Thank you.